Today I've been privileged to be part of the team that is developing the new strategic plan for Amref Health Africa here in Uganda. And in this meeting, we've been focusing on looking at how we can have a plan that will help us address the needs in our communities and also be aligned to the national agenda, the global agenda, and the regional agenda that we have. And so I'm excited and looking forward to the next few years, where as Amref Health Africa in Uganda, we shall be continuing to do some of those priorities that Amref has always considered as important. One of them has to do with training human resources. Nationally in Uganda, our national development plan is focusing on human capital development, and therefore issues to do with strengthening the human resource and ensuring that our health workers have the skills, have the knowledge, have the attitudes that they require to deliver quality services is of paramount importance. And this is also reflected in our strategic plan. So this is an area where we have always worked as Amref Health Africa, and we are looking forward to continuing to strengthen governance, leadership, and management amongst our health workers. A second area that we have always prioritized as Amref is increasing access to services for disadvantaged communities. And again, this is an area where we intend to expand some of the things that we have been doing, but it's also an area where we have noted that there are areas that have been neglected. And so again, it's exciting to look at how, as an organization, we can contribute to some of these neglected areas. One of those areas is non-communicable diseases. We know that non-communicable diseases have been on the rise in countries like ours, Uganda, and this has received limited attention. And so we are looking at how we can contribute to increasing awareness about non-communicable diseases, but also increase access to services to people who have non-communicable diseases. Mental health is another area that has received a lot more attention, especially as a result of the pandemic. This was able to come to the forefront. And so again, we are looking at some of the things that we can do to increase access to mental health services. The last area that I want to mention in this category is related to increasing services that the youth require. Our population in Uganda, more than half, about 53% of the population is under 18 years. And one of the problems that we have experienced that was emphasized during the pandemic, much as it was already a very glaring area, is the issue of teenage pregnancy. So that again has come to the forefront to highlight the challenge that we have with regard to access to sexual and reproductive health services for young people. And so as Amref Health Africa, we are looking at how we shall be able to work with the young people to ensure that they are able to get age-appropriate information about their sexual and reproductive health and able to access the services that they need. And beyond that, also looking at other ways that we can work with other organizations to help the youth acquire life skills that can help them along their journey. We are very aware that, especially for the young girls, some of them fall into these sexual traps as a result of the poverty that is a huge issue in a country like ours. And so we shall be looking at some of the different innovative strategies that we can use to try and reduce the challenges that are a result of that. Lastly, of course, as an organization, if we are to meet these emerging challenges, talking about things like the COVID-19 pandemic that we are still struggling with, changes that are coming as a result of climate change, changes that are coming as a result of urbanization, we cannot continue to do business as usual. We must look around us, we must engage with the communities around us, we must be a learning organization that is thinking creatively, thinking innovatively, making use of the technology and the opportunities that are around us and that can help us deal with the dynamic changes that we are experiencing. And so as an organization, we are looking at how we shall be able to strengthen our capacity to respond to these changes by building the ability of our human resource to adapt to these changes and to use the most recent available technology and evidence that will enable us to address these issues that I have mentioned. So these are some of the exciting things that we expect to be dealing with come 2023, and we look forward to an exciting process of continuing to work with our stakeholders, with our partners, with our communities to bring lasting health change in Africa.